Today, in our series of videos that are informational for pet owners, we're welcoming Mr. Jose Ramirez of Liberty Mutual. The topic of today's interview is going to be regarding pet insurance, something that I think is essential for pet owners to become more familiar with, specifically as the price of veterinary care continues to go up in our country. So, Jose, welcome today. Thank you for joining us.
Thank you for having me.
So, starting off, just if I may, just tell me a little bit about yourself and your company.
Sure. So, Liberty Mutual, obviously we all know the Liberty commercials. I have been in the insurance business for over 3 years, going on 4. It's a big company where we specialize in all different types of insurance except health, like P&C, home and auto, jewelry, life insurance, and as well as what we're talking today's topic, pet insurance. And my goal is to educate and inform individuals how we can not only insure their personal items and products, but as well as, helping their fur babies, because I think that's very important. They're like family. So I'm glad that I'm here and able to discuss with you the importance of obtaining pet insurance and the benefits that it would help not only their loved ones, but have them live longer and stay with us as long as we can.
Sure. I mean, it's really, really important part of the insurance, the fact that there is a cost associated to being a pet parent. And it is a cost that sometimes takes pet owners by surprise when they're faced with some of these larger bills. So I think we're just kind of rolling into the question is, why is pet insurance important for pet owners to be familiar and ultimately really research and look into?
Well, let's look at it this way. As human beings, we have insurance for our own health. So why not have insurance for our pets? And because it can help with the cost of diagnosing for them, treating and also managing some of the pet illness or injuries that they may occur. Now, of course, as pets, they can't talk, so they can't tell you, hey, my leg is hurting or I'm not feeling well. So it's great to have pet insurance, because then you can actually see a veterinarian or even go to a vet hospital and where they can treat your pet. So it's very important to have that, because it does help. It's expensive out there as well.
Oh, from dental cleaning, it's not unusual for a pet to have between $500 and maybe even $2,000 worth of dental work that needs to be done. If there's trauma, knee surgeries, these days in New Jersey, a torn ligament in the knee could be anywhere between $3,000 and $7,000. Wow. Disease, ultrasounds, x-rays, veterinary medicine is definitely getting more sophisticated, and prices are going up. And it does take pet owners by surprise. In conversation prior to starting this interview and in this conversation, you and I were talking a little bit about the data. And there's a little bit of a discrepancy from what your company data, internal data, and what I was reporting to you as what I'm seeing in our hospitals in New Jersey. So if I may ask you, what is the current market prevalence? What % of pet owners actually have pet insurance?
Right. So, in discussing that, it's funny because I was doing my research too, because always, people do ask me like, hey, what's the percentage? What does it look like? And and if you don't mind, I'm actually going to read this because it's very important, because it's really key that about half, or 44.6% of pet owners state that they currently have pet insurance in a survey on a larger scale, and that's through the NAPHIAs. That's in 2022. They stated that in a report, and that means that more than 4.1 million pets were insured in North America in 2021, which is 3.45 million in 2020. So it actually went up, which is actually very good. That actually owners are actually taking the initiative to actually insure pets. So it has gone up that we are actually taking the initiative and insuring our pets.
Yeah. So to that extent, I mean, the increase in utilization and the number of pets that have insurance going up. On the clinical side, as a veterinarian, I definitely see a lot more companies entering the market. Yes. But what is shocking to me, and the reason that I brought this up and you and I were having a conversation, was, the organization that you quoted for is the National Organization for Pet Insurance Providers, right? And that data shows 44% roughly of pet owners have insurance. The discrepancy is that if you had asked me what percent of my patients actually have pet insurance or utilize pet insurance, it's probably less than 1 out of 10. So there appears to be a huge gap between what people, if they have it, are they utilizing the insurance? Do they even know that they have it? And there's a little bit of a disconnect between that data, but still, it's less than half of all pets in the best of all scenarios. So it means to me that there's still a huge gap between what owners think they need for their pets and what they're actually utilizing for their pets in terms of insurance.
And that's correct. And I agree 100%. Some pet owners have the insurance, but they don't know what entails in the insurance. Sometimes they don't know that it covers certain illnesses or certain things that the pet may have, whether it's a dog or cat. They just feel that, well, I just have pet insurance because I have pet insurance, but they don't know what it really entails. And it really takes a person who really specializes in that to really break it down. And that's something that I love to do. Is like, I break it down for them. I even send them an email of just a snippet of what it entails. So this way they are aware of it. They can keep it, have a little folder, because you never know. You're going to go to a vet, and maybe instead of going to the vet, you should have gone to the hospital. So there's certain things that, like you said, there's a disconnect of information that they are aware of, that maybe they're not utilizing their pet insurance properly. And that's where we like to educate and inform them.
So, kind of rolling in through that further is, so a common question that clients ask me when I ask a question, do you have pet insurance? Have you looked into it? They will routinely ask me, so what does it cover? What does it not cover? So can you give me a general idea as to if somebody's looking at the pet insurance, what parameters should they be looking at? What can differentiate one company with another? What does typical pet insurance cover? Does it cover an exam, vaccines, diseases, cancer?
Good question. So there's for a company that we utilize Hartville Pet Insurance. Now you have basically three insurances that you could obtain. You have the main insurance, which is basically covers accidents, illnesses, dental disease, treatments, diagnostics, exams, behavioral issues. Now, if you want to go more into, you will pay a little bit more, because that way now they'll go into fecal tests, blood tests, urine tests, because obviously the pet can't tell you like, hey, I'm hurting, so they're gonna do more diagnostic. So you can go more into that aspect. Also, the rabies or Lyme, they can do that, and that would be more on a basic. And then if you have the prime, that would include everything I just said, but also includes wellness exam, deworming, dental cleaning, and spay and neuter. So there's different insurance that they could obtain. It's just based what it makes sense for them. But also, what if it's a puppy? See, here's the thing. What I say, when it's a puppy, they're very healthy, so they don't have a lot of conditions. But as they're getting older, then I say to them, hey, what type of dog do you have? What type of cat? How old is the pet? And then from there, we can kind of discuss, what, at this age, you may want to consider this package, because you're going to need to go and see the vet more often. So there are different conditions and different packages that will be best for the pet.
Yeah. So basically, a basic breakdown is you have the insurance part that covers pretty much diseases, right, or trauma. And that can be chronic disease from heart, kidney, lungs, skin, allergies, asthma, you name it, but doesn't necessarily cover the wellness care, your yearly exam, your vaccines, your routine wellness blood work. That would be an add-on typically to most insurance policies. But the diagnostics aspect, if animals need x-rays, blood work, ultrasounds, CAT scans, MRIs, as part of the disease, that's typically covered along with the treatment that goes into it for those.
Correct.
Yeah.
Correct.
There's by definition a price difference. I always tell owners, at the bare minimum, you need to be covered for the medical expenses if something happens to your pet. It gets stepped on, it gets hit by a car, it develops some disease. That's a very basic. That's a really expensive stuff. The add-on, which is the wellness care, is good to have. It helps you budget, but you should consider that as an add-on expense.
Right.
But the big expenses are in sickness, trauma, disease. Yeah.
Correct. And typically, and again, it's almost just like in a human health insurance. I mean, we do have deductibles. We have reimbursement percentage, annual deductible, annual limits. So I can kind of package it for them so
Mhm.
that it makes sense for them, because hey, they may want 70% reimbursement, maybe 80 or 90%. But on a typical, you're looking about maybe 20 to 25, maybe $30 just on his own. And with the add-ons, you're looking for an extra $10 if you want the basic add-on, or if you want the prime add-on, just an extra $24.95, just say $25. So you're looking about between 50 and 60 if you want the full package per se.
I want to circle back to something that you commented on that kind of took me a little bit by surprise, but in a very good way. You mentioned that when you're talking to your clients, you are revisiting the pet insurance policies that the pet owners have acquired with you, to make sure that as the pet ages and their medical needs change, that the insurance policies kind of evolve based on their needs. Can you tell me a little bit more about that?
Right. So, in that regards, when they're a puppy, they're healthy, like you said, they're still gonna have to go see the vet, obviously do their checkups. But versus maybe an older dog or older cat, that now, maybe their diet may change, or maybe they're not as active as normal. So now you want to say, hey, what's going on? Maybe my dog needs maybe certain vitamins, or maybe they need a checkup. And now when I have that conversation, maybe a year, 2 years, depending how long my client's been with me, I could just say, hey, how, has things changed? How's your dog doing? How's your cat doing? Have you seen anything that's changed? And just having them go over that conversation, you know what? Yes, my dog's healthy, it's good, it's still running around. Or they can say, yeah, I noticed that my dog is, not being itself, or my cat's not being itself. So therefore, I may have to, take them more often to the vet, and or maybe to the hospital. And I've noticed that it costs a little bit more, and that's when I can say, well, you know what, we do have another package that we can actually add on that will cover some of these things for you. And I would just go over that with them. And of course, it does make sense for them, because we would do it for ourselves as humans. Why not do it for our fur babies as well? So that's when I would have that conversation with them.
So yeah, I mean, and that to me is critical, is that insurance, the insurance needs of the pet can change throughout the life. Therefore, revisiting the policies, and all the pet insurance providers have multiple variations and policies and add-on packages that may or may not be appropriate for the pet, for each individual pet, depending on its health status and its age, and also what the owner is looking, how much protection from risk, financial risk, the owner is willing to pay for from the pet insurance itself.
Right.
One of the questions that I get a lot from clients is, how does pet insurance differ from human medical insurance, and how are deductibles handled? How are claims handled? Paperwork. There's a lot that goes into this that pet
Right.
owners just may not be aware of.
Right. So for deductible, say for us would be more like managed care, versus for the pet, it would be a fee for service. So for us, we will have to pay the provider directly. So with the pet insurance, we would have to pay, but then we can submit it and we can actually get some of that reimbursed it back. And that's when I have the conversation where I would say to them, hey, the percentage you want 70% reimbursed it back, 80%, 90%. Again, you're tweaking the policy for them. Again, with the deductibles, where you can have 100, 250, 500. So it's all based on how often they feel they're going to be going to the vet on an annual basis. You could have a limit from 5,000, 10,000, 20,000, unlimited. But all that goes into, at the end, what the cost is going to be. So it could be as low as, that I've seen, 50, 60 dollars a month, to 120 to 200, depending on how often. Maybe they have more than one pet. Maybe they have a dog, maybe they have a cat, or they have two dogs, or so it all depends how many pets they have or how often they're gonna go. And then I can kind of work with them on how we're gonna, position their deductibles for them.
Sure.
And then for
And
the
the deductible is on a year to year basis. It's based on the calendar year, based on the renewal of the policy. Is that correct?
correct, yes, and the renewal of the policy, yes.
So, and you mentioned the insurance amounts, the coverages, 5,000, 10,000, 20, 30, unlimited. What ranges do you recommend? There has to be a sweet spot in terms of value where
Right.
paying more doesn't necessarily give you more.
Correct.
What is in your assessment the sweet spots for pet owners to be covered?
Well, so it's almost, and that is actually a great question. It's almost like, again, going back to where they're puppy, they're kitten. We could do something as low as 5,000 because they're so healthy, they're not gonna go as often to the vet, or have an emergency. God forbid they go to the hospital. But normally the sweet spot, I'm looking between 10,000 and 15,000, because as they get older, that's when they're gonna need more, maybe a wellness care, a checkup. Maybe they're a little bit older, they're getting into things and they eat something. So that's where I would say maybe, 10 to 15, but I break that down with the client to kind of how it will look for them financially as well, because at the end of the day, I have to look for them financially, what's in their pocket, because if they can't afford it, I'm not going to give them something that they cannot afford either. But I give them my assess of what's best for the pet. So I'm looking the sweet spot between 10,000 to 15,000, the annual limit, but it resets every year. So it will be up to them. So we could start off as a puppy at 5,000, and then in the next year, maybe they may want to keep it at 5,000, or maybe they want to reset it to 10,000, whatever is best for them, whatever they feel is best for them.
And I really like that you picked that spot. There are clients whose dogs have chronic disease, maybe overlapping over 12, 18, 24 months, could spend 20, 30,000. But even with prices going up and cost of veterinary medicine skyrocketing, $10,000 buys you a lot of veterinary care in this country, very advanced veterinary care in this country on a year-to-year basis. There's going to be outliers, but there's not a need for owners to overinsure themselves if the probability of having those kind of expenses is very, very low.
Yes.
So, and I would say that to me would be a take home to anybody who's watching this video is avoid the temptation to overinsure your pet if that is going to limit your ability to buy insurance. Buying insurance at 5,000, 10,000, 15,000 is that 10 to, I agree, 10 to 15 is a sweet spot. Anything above 20, you're probably overinsured if the policy cost is putting a stretch on your financial ability to take care of your pet.
That's correct. I totally agree. And the good thing about adding the preventative care, aside from just having the minimum basic, the two takeaways also there, no copays or waiting periods. And here's another thing that a lot of people don't know, that they feel like almost like us, like, okay, we're gonna a network or add a network. There's really none of that. You can go to any vet of your choice, and you can go to any vet hospital. So let's say I am in Jersey, I am visiting friends in Texas, I have my dog with me, and it gets sick. You can literally go to any vet or any veteran hospital. So that's not a problem.
Yeah, and I want to reinforce that because that's critical. It's a key difference between veterinary pet insurance and human medical insurance, is that it's not a network base, it is not a provider base. It's a reimbursement of expenses incurred by the pet owner, that regardless as to where those expenses were incurred, as long as they were approved as part of the policy. You can go to any veterinarian, an emergency, a specialty, you're covered. And that's a key difference. Let's segue a little bit into one of the topics that pet owners have a lot of misunderstanding, specifically pertaining to pre-existing conditions. What is a pre-existing condition as it pertains to the policies and the companies that you work with?
So, for example, and that's a question that I do have a conversation with, and I say to them, to them, does your dog have a pre-existing condition? In other words, maybe I'm just thinking, maybe it's not breathing well, or maybe there is some type of, God forbid, little cancer in them. So now we're kind of having that conversation where, okay, yes, you should still have pet insurance, but because it has a pre-existing condition, it may be a possibility that they may not be able to treat that pre-existing condition. But what they can do is they can also help with other medical issues that are unrelated to the conditions, maybe new injuries or new illness that may arise. But when it comes to pre-existing conditions, that's also that a lot of vets or vet hospitals, unfortunately, with pet insurance, they won't treat them or take them because of the fact they feel like, for example, my dog already has a condition, let me get pet insurance so they can be covered. So it's almost where a lot of people are seeing that or were doing that in the past, and that's where they caught on. So now it's like, well, your dog has already a pre-existing condition, now that it arrives, versus when they're a puppy or they're a kitten, hey, get the insurance now. This way, if something does come up, it could be treatable, it could be detected, versus now the dog or cat has it. Now you want to add pet insurance. So it's good for new injuries, new illnesses. But when it comes to existing, I've noticed that a lot of vets or vet hospitals, they probably won't be able to take the insurance.
Yeah.
And that's not just the company we work with, but that's all other companies as well.
The two take homes is get insurance while your pet is healthy. Don't wait until a diagnosis has been made, because those medical records are going to be reviewed. And if it's somewhere in that medical record, there is a mentioning of a lameness, of an allergy, of some sort of gastrointestinal, those items will be excluded moving forward. So one is get insurance when your pet is healthy. Don't wait until you find out that there's an illness that's been diagnosed. But also, as you mentioned, the fact that your pet, let's say, has allergies, skin allergies. Yes, the skin allergies might be excluded in the future, but any other disease that's unrelated to skin allergies would be covered. So if there is a pre-existing condition, don't think that your pet will not be covered in the future. Another common question I get is, are there age limits? How early can you get insurance, and how up to what age does insurance typically cover?
So I would say for cats and dogs, that will be 8 weeks and older that they're eligible to obtain pet insurance. So let's say if they just recently got a puppy, just wait till at least they're 8 weeks, and then we could go ahead and insure the kitten or dog.
Okay. And is there a maximum age at some point where the companies will terminate insurance if they've had it? What do different companies tend to do?
Of course, if the dog is it's now older, and you feel that maybe my dog has, and I hate to say this, maybe a couple of months or maybe a year or two. I mean, again, it's always good to have some type of insurance, because we want them to live forever. Right?
Yes.
We really want them to live forever. But if you can kind of prolong a little bit more years, then I say it's really no age from 8 weeks and up. You should get some type of insurance no matter what. You never know.
One of the data points that is the driving force behind PepiPets was the realization that upwards of 50% of pet owners stipulate that they really can't afford the pet care that they would like for their pets. And as a veterinarian, when I'm in the exam room and I'm talking to pet owners and we're discussing the test results and the medical recommendations, it is absolutely heartbreaking to have the decisions become financial. And owners are being forced to make an economic decision on what they consider to be a beloved family member. And that is just absolutely heartbreaking. And there's a solution to this. And part of the solution is pet insurance, right? It helps you navigate that financial aspect of the care for your pet. Any additional thoughts that you would have, and any recommendations that you would have for pet owners as it pertains specifically to pet insurance?
I definitely would just say, just have some type of pet insurance, because the fact that just like we like to take care of ourselves, we go to see the doctors, for any medical condition we may have, pets also the same thing with them, cats and dogs, same thing. So I would say that if you love your dog, you love your cat, they're part of your family, I would say have some type of insurance. We can have a discussion, whether if it's with me or other pet insurance provider, have something in place, because you just never know. I mean, you're not just going to have a dog or cat and, not have nothing for them, and then they get sick, and, what's the sense of really having it? And then, you also, again, part of the family, you have your kids grow up with the pet as well. They get attached, and, you don't want to see nothing happen to the dog, cat, because that really, it's going to hurt the whole family. I would say just have some type of pet insurance, just like we have our own insurance to check ourselves every now and then. Have your dog and cat checked now and then, because you never know, you might be able to prevent something in the future, and by having it checked, you can prolong the life of your loved one, of your pet.
Yeah, so I agree. I think that pet owners tend to do a lot of research into what breed is better for my family, what size. They put humongous amounts of effort into picking the right food and which brand is better. And yet, when it comes down to the very basics, can I afford the long-term care? There appears to be a big gap right now into the research that's being done and where the focus is. And I would tell pet owners, focus on the ability to provide the care that you would want for your pet. After that, then you can start saying, okay, foods and breeds and everything else, but you need to be able to afford the care that you would want. If somebody wanted to get a hold of you, how would somebody be able to do so?
Call my office number, which is the 908-326-1558. If not, they can call my personal phone, and that number is 862-330-0377. They can email me at jose.ramirez, RAMIREZ @libertymutual.com.
Jose, I can't thank you enough for joining me today. I think that this is something, like I said, moving forward, pet owners really need to put a little bit more time and effort in researching insurance. There's a big disconnect between rising costs and ability for people to afford that care. So thank you very much for joining me. And I look forward to seeing you.
Thank you, Jose, as well. Thank you so much for having me.